Hi, Live Love family. Happy Friday. Emily here with your weekly update. Woo! Okay. Thank you all so much for chipping in this morning for CoCo. I'm still kind of like processing through, the adrenaline rush of some of these emergency rescues, but it means so much to us that you guys are stepping up to help us cover the cost of his care because it was not in the bank account when we took him in this morning. And thank you all for making this possible. So going right into it, intakes CoCo, who we just had a street rescue for this morning. And also, I don't want this to overshadow our adorable little grandpa, Mert. Mert is here. He's with us. He's a Live Love dog. We're so excited for that. So those two guys are safe with our team now. Foster to adopt, Greg went on his foster to adopt. He was highly sought after. We don't have any new adoptions to report this week, but soon. Okay, so for medical updates, new Guy Cashew had his wound checked. You might remember last week we pulled him from the shelter. He had that gnarly wound on his hip. Thankfully, it is healing really well just with oral antibiotics and pain medicine, and also him taking it easy. Because of where that is, it's really important that he's doing crate rest. So thank you to Louisa and Mateus for keeping him calm. He also got his rabies vaccine since that hadn't been updated at the shelter. New Guy CoCo is at Long Beach Animal Emergency Hospital receiving life-saving care right now. He was in a serious state of shock and was not very responsive when brought to the vet. Looks like he's been hit by a car. That's what we suspect. They're monitoring him for internal bleeding in the chest. It seems like he does have a pulmonary contusion, and also looks like his femur is fractured in 3 places, and he has some pelvic fractures as well. So we're trying to assess the best route forward for that. But first things first is just getting him stable. He's responding well to pain meds and fluids. His blood pressure's normalized. He's getting some color back. His gums were super pale, and his blood work looks okay other than the lactate, which is common after a dog has sustained a traumatic injury like this. Another thing they're monitoring for is a traumatic brain injury, just because of how disoriented he was when he first came in. But so far, so good. Thank you again for donating and making this care possible for him. Greg was neutered and microchipped, so now he can start his foster to adopt. Hooray! Wyatt is going back to the vet today to just check his mobility and probably do some more blood work. We're just monitoring him really closely to make sure that he's making steady improvements and progress. Huge thanks to Cynthia for all of the loving care she's giving to him, and to Dana for doing the Beamer and Skin R treatments on him. We love using those holistic treatments for dogs in our care, and Wyatt is getting all the best. Okay, Adoptable Willie he's still been drinking and urinating a lot, so we brought him back in to check urinalysis and do some more blood work. Thankfully, everything looks okay with that, so we're thinking this might be a little bit of senility for him right now, with his age, the young age of 17. But he's happy, he's healthy. His foster mom, Gail, is wonderful. She just wanted to make sure we were checking everything, and we now have. So that is Willie's update. Forever Foster Millie went in for an eye, ear, skin infection. She was just all inflamed. So we're getting that taken care of. Forever Foster Fergie is having her urinalysis rechecked. She had a UTI a few weeks ago. It was clean last time we checked it last week, but we are checking it again just to be sure, because those are pretty chronic for her, those UTIs. And Forever Foster Zeppelin had a checkup for his IBD, and we got him some fancy schmancy probiotics, and he got some metronidazole, so he's feeling better and is on the mend now. And then last but not least, new Guy Mert is at the vet today. He's going to be getting a myriad of treatments. He's got a lot going on. His teeth and his jaw are severely infected. Not really sure, but I wouldn't be surprised if we have a fracture or some type of compromise in the jaw bone based on how bad his teeth look. He also has a heart murmur. He's really, really skinny. His body count score is a 3. So he's getting all the best with Dr. Kate today, so we can get him feeling as good as possible in his golden years and take it from there. He is not neutered. He's cryptorchid, and he's also been having a really hard time defecating and having blood from that area. So we would love to be able to get him neutered, but you know, again, step by step, we're going to take it slow with him. Our job right now is to get him at a healthy weight and make sure he's not in discomfort while we get to the point where we can proceed with these surgeries. Typically with dogs like this, we need to do 2 surgeries. The first one would be probably taking care of that crypt orchid, and then the next one would be the dental, or maybe the other way around. Really, it just depends on what the vet thinks is most urgent and what he can endure in his weakened state right now. So that's the update for this week. Donations are really, really needed and very much so appreciated. But just you being here, watching the videos, sharing the stories, commenting, liking, tagging, you know, putting all these dogs in your stories, just spreading the word about Live Love means the world to us. Thank you all so much for being a part of these dogs' rescue journey and a part of our rescue family. I'm sending all of my love to each of you. Please have a very safe and enjoyable Labor Day weekend, and we'll talk to you next week. Thanks, guys.